So I'm Joe Greene. I'm a board-certified orthopedic surgeon specializing in hip and knee reconstruction. We're talking about typical recovery after a knee replacement. First, let's talk about a total knee replacement. That recovery takes a little bit longer than a partial knee replacement. I do think that a full total knee replacement takes a little bit more recovery time than a total hip replacement as well. They're just two different joints. The hip is a ball and socket, so really once you get over the surgical approach, working on the bones and the muscles, really the hip does recover a little bit quicker than the knee. The knee is a more complex joint in the fact that it has three different planes of motion, and there's a lot more to regaining the motion after surgery than a hip replacement. Typically, a knee replacement is done outpatient, so the pain control is pretty good for the first 24 to 36 hours. Then really day 2, day 3, the pain seems to be at its peak, and then slowly it improves. By 2 weeks, people are usually getting up and using the restroom, typically off of the walker and onto a cane by this point. That actually is probably 1 week after surgery on average. And then people are back to walking in the neighborhood about 6 weeks after surgery for a little bit of exercise. If people have a stand-up job that's not too strenuous, they're usually back to work about 6 weeks after a knee replacement. If they really do a lot of squatting, if they're in and out of like an automobile, if they work in a factory that produces automobiles or something similar to that, usually it's about 3 months until you're back to that kind of strenuous kind of work. About 3 months is when people are back to hiking in the woods, walking in the neighborhood for exercise, maybe even starting to play some sports. It's really about 6 months though until my tennis players are back to playing, or racquetball, or bowlers, or people that do that increased twisting kind of motion. A partial knee replacement, I think the recovery is about half of that. So I think most people are off the walker pretty quickly with a partial knee replacement. I think they're back to doing some walking in the neighborhood, 3 to 4 weeks after surgery, and then back to hiking and increased activities about 6 weeks. And back to those strenuous stuff about 3 to 4 months after surgery, like tennis, racquetball, that kind of stuff.